Hello, everyone, and welcome to another great episode of the Jason Howell Company Speaker Series Seminars. My name is Jason Howell, and today our guest is Lisa Humes of Health Markets. Our topic is healthcare after sudden wealth events. But with our topic, we're trying to figure out, what do you do when you have wealth, something has happened, there's sudden wealth in your life, and you no longer need an employer-sponsored plan because you don't need an employer, but you still need medical care? Well, with her many years of experience, Lisa's going to help us answer that question. But before she does, let's just welcome Lisa. Lisa, welcome to the Zoominar. How has your day been so far?
Today's a great day. It's good weather outside, very pleasant, and so that always helps put you in a good mood.
Not too many meetings today or anything like that.
Oh, yes, one back to back to back, but that's okay.
I thought so. That's why I asked. You've always been very, very busy, but you've always been an expert. So you should be busy. People need you in their lives.
I hope so. That's why I'm here.
And that's exactly why you're here. And yeah, and with that, I'm going to go ahead and share my screen, and we're going to get started here and just and start leaning on some of that expertise. So if you came to healthcare after sudden wealth events, you came to the right Zoominar. Want to thank you, Lisa, for being here. It's been a little while since we've seen each other, and certainly a long while since we've actually had coffee or something like that. So I'm glad you could join me and have this conversation.
My pleasure.
Before we start asking those questions, like I mentioned earlier, let's just get a word from our sponsor. And our sponsor is Jason Howell Company. Jason Howell Company is a family wealth management firm specializing in sustainable investing and family governance. We're able to compete with some of the most well-known private bank and wealth advisors by forming a virtual family office with a team of experts and specialists, experts just like Lisa Humes. We're based in Northern Virginia, just outside of the Washington, D.C. area, but we serve clients nationwide. For more about Jason Howell Company, just go to jasonhowell.com. And with that, we focus on Lisa. So Lisa, thank you so much for sharing your bio with me. One of the things, after all these years, that I didn't know about you was all the different kinds of areas of expertise you have. But before I ask you a question or two about that, I love this story you had at the beginning, or at least this foreshadowing of a story or allusion to a story about having a layoff, losing benefits, and that being the trigger for you getting into this business. Tell us a little bit about that.
I came out of the healthcare industry after many years. I kind of worked my way up the ladder, if you will. I got to a middle management kind of position. We went through a big restructure at the healthcare system I was in, and all the positions at my level got cut. So that meant I lost my job very quickly one day without any real forewarning.
Wow.
My benefits went away, and I have 3 kids and a husband. So I was the one that carried the health insurance benefits. So I was the one that was supposed to go out and look because I had a medical background and I had that expertise, quote unquote. It was difficult to know who to trust and what I was getting into. I ended up calling a broker because I got connected through a friend who works for the same company that I do. She came out to the house, we had a conversation, and I decided while we were having that conversation that sounded like something I could do and would be willing to try to help others, with their benefits as well. Signed on with the company that's been going on, it's 11 years, going on 12 now,
Okay.
and I've been here ever since.
Yeah, a broker of insurance, of other insurance companies. It's such a distinction that many people aren't as familiar with because they see commercials on television for one brand and figure, okay, these are my choices or that's my choice. And you do something quite different where you give people exposure to multiple. Is that right?
Yes, that's correct. So all the major carriers in the area, it does depend where you live, what's available to you, depends on the market that you're in. So I work with individuals on and off the marketplace exchange. So that means either private, direct through the company, or on the marketplace, folks in Medicare, or businesses for their employee benefits. So any of those markets might have different insurance companies that do or service the same area or same zip code. It
Yeah,
really is very distinct to what market you're in and where you live.
yeah, we still haven't fixed that legislatively, have we? Where you have to be distinct to where you live. Oh well, you mentioned having a background in healthcare, and I noticed the BS in radiological health administration, and so you were a radiologist of some sort for a while, and that was your track, wasn't it?
I was a radiologic technologist. I was in X-ray. I did a variety of different things, state inspections on X-ray tubes. I worked with a physicist. I went to MRI. I became, manager of that department, et cetera. I was the student liaison and did some adjunct faculty at Nova and at GW with their student populations that were coming into the programs. So yes, I kind of worked my way around the system.
Yeah, you did. It's so nice to have someone who's actually in the profession now, essentially offering the products that may come from it. Very different experience than someone who's just in sales or something and transitions to the health industry. And speaking of having some expertise and knowledge, I learned again, did not know this before, that you not only are someone that works with health insurance carriers, but also life insurances, long-term care is kind of the full gamut when it comes to those different risk management tools that so many of us advisors use for our clients.
And especially if people are in that, I just gained a whole lot of wealth. I also do health insurance for people who travel abroad. So it's important to look at that too. What does your coverage look like if you're doing a trip to Europe or Brazil or whatever country you're going to? You want to make sure that you have some coverage if you have an accident or injury, illness while you're there. So health, life, long-term care, disability, and a whole range of supplemental kind of plans.
A little concierge there, which is what I'm hearing. That's pretty good to hear. I did not know, but now I do, and now we all do. So that'll be helpful. Well, here are our questions for you, Lisa, with our time together.
Mhm.
I remember talking with you after the, great financial crisis and the changes and after the Affordable Care Act had passed in 2010 and how you really stuck to the industry regardless of so many people leaving because they, squeezed commissions out of it. I wonder what your perspective is post-pandemic. How has healthcare changed since 2020, 2021?
So healthcare or the access to get it, I mean, there are a couple of different things I would throw in there. The first one is before the pandemic, I was in my car traveling house to house to house, trying to meet with people to fill out applications and do that sort of thing. There was very little that I could do online as far as complete enrollments are concerned. I could send some information, but I couldn't complete an application. The pandemic forced the industry to make that happen because nobody could meet in person or face
That's
to
right.
face. So now that's much easier to complete applications, do things like we're doing now with Zoom, do it from the comfort of your home or office or wherever you would like to. And so that's been very easy transition to be able to still meet with people kind of on a face-to-face basis, but at least have that opportunity to do it electronically and make it a little easier so you don't have to take time off of work so much and, cancel a big portion of your day.
Yeah.
As far as the products are concerned, I think, those things are always changing and evolving depending upon what's going on in the industry. So we're getting, of course, the COVID vaccinations are coming in and that has to be paid for, and other things like that, or services that are now evolving and have to be covered. So those are good. The downside, of course, costs continue to go up, deductibles go up, out-of-pocket maximums also go up. So those are the downside that I would see. And that was a trend that started before COVID.
Yeah, yeah, have been going. Well, I tell you, one of the reasons I really was excited about having you present with me today is to answer this question that we have next, which is what do people do when they've sold a business, a piece of real estate, a practice, and they leave their employer, which somehow healthcare got attached to employers a long, long time ago, never really detached. But now they really do need to have some kind of medical coverage, and they're kind of left with their hands empty and maybe going to the exchange. What would you do working with someone in that position?
So if I sit down and talk to someone who's losing coverage, first off, I would do some needs analysis to find out a little bit about the demographic makeup of the household. Does anybody have any conditions that make them go to the doctor on a regular basis? If so, what kind of needs do they have? Do they take medication prescribed by a doctor? That sort of thing. And then of course, what medications do you take? Because we want to make sure that they're covered on the list of drugs by the insurance company or plan that you're looking at. What kind of doctors or providers do you need to go to see? And let's try to get as many of those in the network as we can. Of course, the last question, or one of those big things that's going to count on how much you pay for your premium, is what your annual household taxable income is going to be. If you're looking at a marketplace plan, you may have some opportunities for tax credit or subsidy based on income alone. They do not look at assets when we're talking about marketplace or ACA style plans. So we look at taxable income, and then we try to come up with some sort of a plan on what that's going to mean going forward. The downside, since you don't have an employer, you get to subsidize the whole thing or pay the entire premium. The only question is, if that income that you have, your taxable income, does that make enough of a difference that then you're due some tax credits to help bring down that premium and make it a little bit more affordable each and every month? The basic is that the more you make, the more you're going to pay for your health insurance. If you have a lower income, you would get some subsidy and pay less for the health insurance. It's just under 9% is what the average cost of a healthcare plan is supposed to be. So if your income is such that it would cost more than that amount, then you would get some tax credit or subsidy.
And so if I make $100,000 a year and the healthcare coverage that I choose for my family could be $12,000. Obviously, that's more than 9,000, so there could be a tax credit available to me.
Not exactly. So
Okay.
if you have an income of 100,000 and you're a single individual, one person needing insurance at 100,000 probably will not receive any tax credit or subsidy. But if your household size is higher, then you may receive some. It's actually based on the average cost of the cheapest silver plan available in your market. So
Okay.
it's something that, I honestly couldn't tell you what the number is. It's a very fluid calculation. I cheat because I have my little calculator and I plug in
Uh-huh.
numbers and it tells me what's
We have our
available.
tricks.
And it comes within $1 or two of what the actual numbers are going to be. So I can tell ahead of time what it's going to look like. So that gives me some clues as to where we might want to go.
A simpler way I could have asked this question is if I'm a multimillionaire, because that's really who I'm thinking of, someone who becomes a multimillionaire because they've sold a business or a piece of real estate. They've got $15 million that came in that year. So their income maybe that year is pretty gosh darn high. Are they really going to the exchange to get health insurance, or is there a more direct route to, say, Blue Cross Blue Shield or Aetna or someone like that?
It's possible you might still want to go to the exchange. It depends on several factors when we're applying, because if you're applying direct through the insurance company, you have to apply by the 15th of the month in order to get first of the following month coverage. If you come to me at the end of the month and say, I've just lost my plan, I need coverage in 3 days, we're going to the marketplace because they force that effective date.
That's right.
So it
And
depends.
it does depend, not surprised. And this next question, I think you've answered about the difference in coverage depending on where you live. It does.
Mhm.
Um, in Virginia, for example, the carriers that are offered here, I guess those are the carriers that are offered through the exchange. Is that right?
So the carriers that are offered on the exchange are generally the same carriers that offer off exchange plans as well.
Okay.
Some do, some do not. But if you're going off exchange, it's the same grouping of plans that would be offered on the exchange. There generally isn't a big difference. In some areas, not all, but in some areas of Virginia, we do have an option to go direct through one carrier and get a little bit bigger network of providers. So instead of the just traditional HMO plan, which is on exchange, you have the opportunity to get a bigger network with a POS, point of service plan, and the option to get coverage around the United States through Blue Cross Blue Shield, PPO, Key Care Network. But it, when you go in direct through the carrier, there's no tax credit, no subsidy. Yes, that person may have a very large income in one year, but the next year, their income, taxable income, may be much lower and therefore still eligible for a tax credit, subsidy, because of the taxable income. Again, they're not looking at assets at this stage at the marketplace.
Okay. And you mentioned income a few times. Is there any distinction on earned income versus, say, interest income or income from investments?
Oh, good question. There is not. If it's a line item that applies to your adjusted gross income, then it does apply.
Okay.
If
Okay.
it's something that you're pulling money out of the bank account and it's not showing up on your tax return,
Hmm.
it doesn't apply. You know, if it's
Right.
in savings, it's liquid money, you're pulling it out, you've already paid taxes on it. That's not going to be on your tax return. So it doesn't apply to the total calculation.
Yeah. So if it's a 1099 or a W-2, it probably counts.
Yes, it does.
All
And that's
right.
also a good point too, that if someone has real estate and they have to form a corporation to be able to put the real estate under that umbrella, they may be eligible for group health insurance. In the state of Virginia, we can get group health insurance for a group of one and still have options to get PPO insurance, really good plans through that path.
That's if they're in the real estate business.
Not necessarily real estate business, but if you're a solopreneur
Hmm.
or 1099 person, obviously that person that just made big income isn't going to be 1099, but they may be a solopreneur at some point because of some other ventures that they have going on, if it's real
Right.
estate or things like that.
Okay. Yeah. Lots of nuance, for sure. Well,
Mhm.
tell us a little bit about the pharmaceutical industry. I remember we were talking about this before. You said it's a big topic, but there's actual medical care, and then there are the drugs that many people need to continue to live. How is that changing? Maybe you can just say since the pandemic.
It's been an explosion of what's available out there. And of course, the costs that are associated with those medications. If you see a drug on TV, somebody has to pay for that commercial.
Hmm.
Likely it's going to be passed down to the people who are taking the medication. So they are expensive. When you're in Medicare, there's a whole different nuance of how drugs are going to be paid as far as costs and so forth. There's going to be a huge change in 2025 with a piece of the Inflation Reduction Act that was passed a few years ago that kicks in January 25 for Medicare folks on prescription drug coverage. There was some prescription drug changes this year for asthmatics and inhalers and things like that, but it didn't affect the Medicare folks. It was only for the non-Medicare folks. So it's kind of a crazy business that on one side you've got Medicare and how prescriptions are covered, and the under 65 or non-Medicare crowd and how they cover prescriptions. They're a little different. It's definitely worth a conversation, and it really depends on your specific circumstance.
Probably the specific drugs that you need for health maintenance.
Correct.
Okay. No, that's helpful and probably probably keeps that conversation nice and tight enough. Well, you mentioned Medicare. Some people know, some people don't know. Medicare doesn't cover everything, but regardless of that, there are people that I speak with that are worried about, along with Social Security, Medicare coverage running out. Is that something that you worry about?
I worry about only what I know that and what's tangible in today's world, because if we speculated on all the things that were possibilities, there would be so much more to worry about.
Hmm.
And in reality, this keeps me busy enough.
Yeah,
From
yeah, suppose so.
Medicare itself, I think that's a conversation that folks should have with you, their financial planner, 2 to 3 years ahead of time before Medicare is even on the horizon for you or the applications are being done. There is that income related monthly adjusted amount, IRMAA or IRMA charge, that does apply to Medicare. So right now, for example, the base rate for Medicare Part B is $174.70. However, if you, as a single individual, make more than $103,000, or as a couple, $206,000, and they're looking back 2 years. So they look at right now, they're looking at 2022 tax returns. If you were employed and making a much higher wage versus now you're retired and your income is lower, you could be setting yourself up for some higher costs in Medicare. There are ways to put in appeals and things like that. But if your income is higher, you will pay more. And right now, the high point is just over $600 per month. So that 175 turns into 600 plus pretty
Oof,
quickly
wow.
if your income is high. And then we haven't started to talk about the things to cover what's not covered by Medicare, because Medicare A and B don't cover prescriptions. And as you mentioned, there's a lot of financial costs that are not covered in Medicare as well that falls to you as the beneficiary. So we got to get those things covered to give you the best possible options for your situation.
And I love having you here because one of the things that Medicare doesn't cover, but for 20 days, is long-term health care. And there has been such a journey over the past 15 years around that product, long-term care insurance. I'd love to hear your perspective on long-term care, health care, regardless of the product.
So for most folks, a hospitalization is generally covered at least at some level for a long period of time, depending upon which products you have. Medicare will cover generally 90 days in the hospital. That's more than enough for most people. But if you have supplemental coverage, it could cover up to 365 days. After that, it's considered long-term care. But as you mentioned, skilled nursing is another area. And for the first 20 days, you don't have any costs or co-pays typically. Again, depends on what kind of coverage you have. But Medicare actually covers up to 100 days in a skilled nursing facility. After
Okay.
the first 20 days, they're working pretty hard to move you on. But if you
Yeah.
needed it, you could get up to 100 days. After that, it is considered long-term care, and Medicare doesn't pay for it. The plans don't pay for it. Those costs come to you. Looking at long-term care costs and coverage is important. I believe even if you started in your 40s or early 50s, you're not looking too early, because the earlier you look, the cheaper the premiums, the healthier you are. And so the more apt to get a product underwritten and pass all with flying colors is higher the younger that you are. If you wait till later and you're in Medicare or past Medicare and you're, in your 70s, it's going to be a much harder thing to do and a lot more expensive. Long-term care coverage typically leverages the dollars that you have very well for that benefit and that benefit only. So sometimes having a long-term care product in place is better than trying to self-pay and pay out of your own retirement savings.
Got it. And then you also have a pretty good feeling around some of the hybrid policies with life insurance that many of the carriers and their agents are promoting also.
So the difference between a traditional long-term care product and these hybrid products, there are a couple of things. I could go on about this topic for a long time, but the traditional long-term care products are pay for your lifetime. You're paying premiums over your lifetime. They continue to increase as you get older, and it's based on how much claim is, or how many claims are being paid out by the company that you have that product through, so the costs can just skyrocket. It's difficult for people as they get older to be able to maintain or keep up with those premiums. So sometimes they'll lose it or settle for a reduced benefit because they just can't afford to keep up with the premiums. Traditional long-term care insurance, so pay over your lifetime. It's usually set up as a use it or lose it kind of benefit. So if you don't use it, your benefit is gone, your money's gone. And they will pay only as a reimbursement. So you have to show your receipts to be able to recoup that money that was spent throughout the month. The other way to look at it, as you said, the hybrid products with life insurance and long-term care, those generally are paid off. You can pay them off in 1 year, up to 15 years, but generally they're paid off. So you don't have to worry about it well into your retirement age. You get your money back in one of three ways. Many of them can recoup your premium money after a period of time. If you don't want it any longer, you get it back as a death benefit, or you get it back as long-term care benefit with a small death benefit left over. And they are indemnity style payouts. So that means that once you're eligible for the benefit, you can't do 2 out of 6 ADLs of activities of daily living. Once you turn on that switch, they just pay you the money. You don't have to show them receipts. They just pay you the benefit on a monthly basis as long as you're still eligible. Most plans will have you recertify about once a year to make sure that you're still eligible for that benefit, but then just send the check. So
Nice.
those are some basic differences.
Yeah, those are some real tangible differences. Thank you for sharing those. I did get a question from the chat, and the question is about one of our earlier parts of our conversation. Is the pricing different for the same provider if you go through the exchange versus going directly to the carrier?
Typically the same price or very close.
Okay. Okay. That was a really good question. Well, it's helpful. We've taken a nice amount of your time, Lisa, so I'm going to stop the share and prepare everyone for much bigger faces. And I want to thank you for really exhibiting some expertise, because that's a lot of stuff that you shared with us. But out of all of that, is there one thing that either a viewer today or someone coming upon the recording later should think about when they're maybe about to have a life event or a wealth event coming up and still need that coverage? What's their first step?
I would say they should either talk to someone like yourself that would help them set up the overall picture so that you do know about many different aspects of how your life's going to change. By all means, find someone who is reputable and someone who's trustworthy, somebody you can talk to and be there for you over time that you can call and follow up with. It costs nothing, by the way, to have a broker. So to have someone like myself working on your behalf, there's no charge for that. We get paid by the insurance companies. It's all the same price. Everything's industry regulated. So it's the same cost, whether you try to navigate it yourself, have a broker, or call some 800 number. It's going to be the same cost for the same plan.
And remember, Lisa, to not hide the fact that you act like a little bit of an international concierge. That's a pretty good part. I didn't know about that.
Yes.
Thank you for that.
Yes, and the more products I have, the more resources I have, just as yourself. The more resources that you have to offer your clients, it makes a much better overall picture, helps them out in many more ways than just one aspect of what you actually do. You're connecting them to so many good resources and helping them in many facets of their life.
Lisa Humes, Health markets, licensed insurance agent, concierge, and very nice person. Thank you so much for being here today and sharing your expertise with us.
My pleasure. Thank you for the opportunity.
With that, I yield the balance of your time. Take care.